Hello and welcome to Mental Health Matters. I'm Edgar Wiggins, your host for this program that is dedicated to providing you with practical and useful information regarding mental health issues and needs. It has long been recognized that there are significant differences between the way that African Americans and other minority groups access, utilize, and benefit from healthcare services. Today, to help us understand this significant issue and what we can do, we are joined by Dr. Lisa Cooper, who is an Associate Professor of Medicine, Epidemiology, and Health Policy and Management at Johns Hopkins University. Dr. Annelle Prim, who is an Associate Professor of Psychiatry at Johns Hopkins and is the Director of the Office of Minority and National Affairs at the American Psychiatric Association. And also Dr. Michael Torres, who is a board-certified psychiatrist, an ordained minister, and is president of the Institute for Mental Health Ministry, Incorporated, here in Baltimore. Welcome to Mental Health Matters, doctors. This is a very interesting issue and topic. Let's start off with you, Dr. Cooper, by talking about some of the differences that seem to exist in terms of how African Americans and other groups access medical care, and also some of the particular illnesses that seem to be problematic for those minority communities.
Yes, well, it's been documented for decades now that African Americans and other ethnic minorities suffer from several diseases at higher rates than whites. So, for example, we probably know the most about cardiovascular diseases, which includes things like hypertension, heart disease, and stroke. That's also true for diabetes and for cancer and a number of diseases that African Americans and often Hispanics as well suffer at higher rates than whites from these illnesses. And although we know that there are problems with access to health care that play a part in why they might have worse health, we also know that even when they do access health care services, that they don't receive the treatment that we know is appropriate for them.
Now, these are all significant illnesses that in fact are life-threatening. So this is a very serious matter. When African Americans access health care, when they reach out, what happens? What are some of the problems with some of the outcomes of the services?
Right. Well, there are problems at several levels throughout the healthcare system. For example, we know that African Americans tend to wait longer for appointments and to be less likely to follow up for certain types of treatments. And this is true across disease categories. So it's not for one particular type of illness, but it's true regardless of whether you're talking about cancer or heart disease or diabetes, kidney disease, HIV. We also know that even once they've seen a physician or another healthcare provider, that they're less likely to receive a prescription for an appropriate drug or to be referred for an appropriate procedure for that illness. So it happens at several levels, at entry into the system, waiting for appointments, and then also receiving treatments once they have seen a physician. And then one particular area that's received a lot of attention recently, in an area in which I've focused a lot of my work, is the area of patient-provider communication. And so we've even identified that there are differences in the communication process, in the information that African Americans receive, and in the nature of the interpersonal care that they receive.
Well, one of the things that you and I have talked about over the years, Dr. Prim, has been this issue of cultural barriers to, especially and specifically, mental health care. And if there are, in fact, communication problems in terms of somatic issues, as Dr. Cooper has shared with us, then what happens on the mental health side? Are African Americans likely to reach out for services? Can you say a little bit about that?
Well, I think the same concerns hold true for the mental health sector. And we know that, African Americans already have some concerns about seeking mental health services because of the stigma associated with having a mental illness and being African American, which is also stigmatized in our society. And then on top of that, the tendency for African Americans to not trust the healthcare community. Looking at some of the historical things that have occurred from slavery, discrimination, racism, the Tuskegee experiment, all of those things contribute to some of the ways in which African Americans perceive healthcare providers. And then on top of that, the importance of religion and spirituality, and in some cases the reliance on the faith community for help with different sorts of problems, including mental health, instead of professional sources of help. All of these can contribute to some of the differences. And in terms of communication, there are biases that even mental health providers hold towards African Americans that interfere with them understanding what African Americans are talking about, and certainly the trust issue comes into play there as well.
When you talked about the issue of the faith community, that's an obvious segue into hearing from Dr. Torres, who is both a board-certified psychiatrist and an ordained minister. Dr. Torres, can you talk some about the interplay of spirituality, perhaps touch on how sometimes religion can be actually a barrier to receiving good mental health care or health care in general?
Yes, I think that there's long been a tension between the faith community and the mental health community, and that is because it has been perceived for many years that mental health professionals do not consider spirituality a significant aspect of the individual, and very much downplayed that in terms of the delivery of services. And so in the faith community, even if individuals are identified who might need professional services, there's a reluctance to refer those individuals to the mental health system for fear that their beliefs will be challenged or negated or neglected.
Mm-hmm, mm-hmm. One of the things that is interesting to me is, I've long thought about how much everything becomes a double-edged sword in some ways. And in many ways, the African American community has relied on itself, has relied on things like spirituality, religious faith, and so forth for comfort, support, and now it becomes in some ways a barrier potentially to getting the kind of care that we need. Dr. Cooper, you talked about problems in communication, you talked about problems in fact with people getting the appropriate level of care. The other two physicians are talking about a distrust for reasons that are based in historical fact. Can you say some more, though, about on the healthcare end, on the systems end, what's the problem? What is it that we don't get?
Right. Well, I think that the problem is in several places within the healthcare system. The healthcare system is a microcosm of the larger society. Mm-hmm. A lot of the providers that deliver care in the healthcare system belong to ethnic majority groups and may not completely understand the needs and concerns and barriers of ethnic minority patients because of cultural differences. So there are cultural differences between the providers in the healthcare system and the patients. And then there are some institutional policies and procedures that exist in the healthcare system that are not really designed with minority patients in mind. In particular, some policies that have to do with changing of insurance coverage or requiring people to choose providers that are associated with specific networks, and then that doesn't encourage continuity of relationships over time. And this is particularly important for ethnic minority groups who may have difficulty establishing meaningful relationships.
It's interesting, too, because I sit here and one of the things that I think about, and this may give my age away a little bit, but I think about a very basic thing, that when I was a child and I would get sick, my mother would call the doctor, and the doctor would come to the house, would see me, would provide treatment, would give me a lollipop, and then would go away. And so even when I think about the issues of outreach to minority communities, you know, taking health care to people where they live, as you know, Baltimore Crisis Response, it was thought that it was novel that we would make a home visit to someone who was in a mental health crisis. And of course it makes sense, because those are the very folks who can't get out, who can't reach out for service. So in addition to the other things, it's clear that to some extent, in fact, our healthcare system is not really designed to promote good access in terms of the very people who need the service the most. You've given us a lot to chew on, but we need to take a short break, and we'll be right back.
My hero? Isaiah Thomas. Kevin Costner. Mr. Wong.
These are teachers, but to the kids they've reached, they're heroes.
My hero? Mrs. Wooten. If I don't get through to that child, who knows, maybe no one else will.
Teachers have the power to wake up young minds, to be heroes, to make a difference. Reach for that power. Teach. Find out how by calling 1-800-45-TEACH. Be a teacher. Be a hero.
Drunk driving doesn't just kill drunk drivers. Next time your friend insists on driving drunk, do whatever it takes to stop him.
When Raymond was 6, I was afraid to take him to the playground because they were doing drugs. When he was 10, I couldn't let him play ball in the schoolyard because of the gangs. When he was 15, I wouldn't let him go to any dances because there could be a fight or a shooting. Now he's a man, and I realize he's never been a kid.
Give your children back their childhood. Do something now. Call 1-800-WE-PREVENT. Together, we will take a bite out of crime.
Welcome back to Mental Health Matters. We are joined today by Dr. Lisa Cooper, who is an Associate Professor of Medicine, Epidemiology, and Health Policy and Management at Johns Hopkins University, Dr. Anel Prim, who is an Associate Professor of Psychiatry at Johns Hopkins and is also the Director of the Office of Minority and National Affairs at the American Psychiatric Association, and Dr. Michael Torres, who is also an ordained minister and the President of the Institute for Mental Health Ministries Incorporated right here in Baltimore. Now, before the break, we were talking about, in some detail, about the way in which African Americans and other minorities do not access health care and really, in many ways, receive a less significant benefit from their experience in the healthcare system. To add to that, you talked about how there are some specific chronic illnesses in which the African American community is overrepresented. These are life-threatening illnesses and quite significant. Diabetes, cancer, heart disease.